Ashley Qualls, and I'm going to be doing a head-to-toe assessment. Hi, can you tell me your name and date of birth?
Sarah Medley, July 13th, 1992.
What brings you to the clinic today?
Just a checkup.
So through that little bitty observation, I noticed her walk into the room. She had good gait. Her posture is well. She's erect. I can tell that her hearing is good. She can respond to my questions. She is alert and oriented, and she has good hygiene. Her clothes are appropriate for the season, and she appears well nourished. And also she seems to be in a good mood, and she doesn't seem upset, and she's good affect. So first I'm going to start with your head, and then I'll move through the rest of the body systems. So first I'm going to start by inspecting the face, looking for symmetry. She has a very symmetrical face. All of her, it's very proportional. And so I'm going to start by palpating the skull and the cranium, and I'm checking for any abnormalities, any lesions. Have you ever had any head trauma?
Nope.
Okay, and so...
Not that I remember. Concussion.
Alright, so I don't feel any scarring or bumps. Through this also, I'm feeling her hair. It's soft and thick, and doesn't feel brittle, and I don't feel any places of alopecia, which is baldness. And then I'm going to palpate her lymphatics. And so I'm just going to go in little circular motions. We shouldn't feel any of the lymphatics unless they're enlarged. Okay. So none of her lymphatics are enlarged. Next I'm going to feel her temporal artery. Right here. Very good. And could I have you open and close your mouth? Okay, there I felt her temporal mandible joint, and it was smooth. Next I'll feel her carotid artery, and that is 2+. Now I can move on to her eyes. First I'm just going to inspect. They are equally spaced and proportional to the face. Doesn't look like there's any overt drainage, and doesn't look like there's any lesions. If I had a Snellen chart, I would have her look at it and then close one eye and read the most bottom line she could, and then have her close the other eye and read the most bottom line that she could. But we don't have one, so I won't have to do that. So I'm going to start by checking her peripheral vision. And so will you just tell me when you look straight ahead and tell me when you see my finger wiggling? Okay, continue looking straight ahead. Yeah. Okay, and so she has good peripheral vision. Next, I'm going to test your cranial nerves. This is cranial nerves 3, 4, and 6. And just, if you'll watch my finger and just follow it with your eyes, we're just going to check the 6 cardinal places. Okay. Now I'm going to check for accommodation. So if you'll look at my finger and then look at the wall behind me, and now look back at my finger. And her pupil is equally constricted, so she has good accommodation. Now I'm going to grab my ophthalmic scope. I'm going to look at her cornea. Okay. Just look straight ahead. Okay. Now the other one. Very good. Now I'm going to check for her eyes being equal and reactive to light. So just, I'm going to check your eye, shine your light in your eyeball 2 times each eye. Okay. And they were equal and reactive. Now I'm going to check for the corneal light reflex, so just look straight ahead. I'm checking to see if the light is in the same place on both eyes, and it is. Yes. And now I'm just going to check the sclera and the cornea. So I'm just going to pull down on your eyelids. And the conjunctiva is pink, and the sclera is white. Her irises are and pupils, everything doesn't look like there's any drainage or anything of abnormalities. Okay, so next I'm going to move on to your ears. I'm going to have my otoscope. Maybe I can get it on. There we go. Okay. So first I'm going to check your ears and make sure there's no drainage. And I've already checked that they're symmetrical, and there doesn't seem to be any issues there. So I'm just going to pull the pinna up and back and look for the tympanic membrane. Okay, and it is silvery and gray, so that is a normal finding. I'm going to check this other ear. Excellent. Alright. Okay, now I'm going to do the whisper test to check her hearing. Okay, I'm just going to say a simple sentence and I'm going to whisper it, and if you'll just repeat back what you hear.
70.
Okay, check the other ear.
Apple banana.
Very good. Alright. Now I will check the nose. I've already established that it's symmetric and proportional to the face. First I'm going to occlude each nostril and have you just sniff. And so they're patent, maybe just a little bit stuffy, but it is winter season, so that's to be expected. Then I'm going to take the speculum and just take a little look up here. Alright, and she doesn't have a deviated septum or anything like that, and moist and no lesions. There isn't copious amounts of drainage, so her nose is doing well. So now I'm going to check your mouth. If you'll smile and puff out your cheeks, stick out your tongue. So that tested a lot of the cranial nerves. Now if you will just change this over so I can inspect again. Open your mouth for me. So I'm going to check the upper palate, soft palate, hard palate. Lift up your tongue. See underneath. See her teeth. Looks like she has good oral hygiene. I don't smell any foul breath. Her buccal lining is good. If you'll stick out your tongue and say ah. Ah. I saw her uvula go up and down. That's indicative of the gag reflex. If you'll open your mouth one more time. Stick out your tongue and say ah. Ah. And you've had your tonsils removed. And so I don't see her tonsils. Okay. Now now I'm going to move on to her neck. It is symmetrical. I don't see any lesions. I've already palpated the lymph nodes down there. I've checked the carotid artery. I'm going to check her accessory muscle, or accessory nerve, just by shrugging her shoulders. Good, so that's intact. And now I'm going to check the range of motion of her neck. If you'll go forward, back, side, side. So good range of motion. So now I can check the strength, if you'll shrug your shoulders again. So she has strength in these muscles as well. So next I'm going to move on to her lungs and chest. I'm going to have you kind of swing your back towards me, and I'll have you video maybe back here. First I'm going to configure her thoracic cage. So I'm going to pinch just a little bit of skin and have you take a deep breath. And my thumbs expand symmetrically, which means she has a good expansion. Now I'm going to palpate for tactile firmitus. Every time I place my hand on your back, just say 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99. Alright, and I felt the vibrations, so that was good. And through that I was looking at the symmetry. It doesn't look like she's using a ton of accessory muscles to breathe, so it doesn't seem that she's labored in her breathing. Now I'm going to auscultate. And if you'll just take a deep breath every time I move my stethoscope. Very good. Okay. And you don't have any tenderness in your back, do you? Or I didn't feel any masses when I was doing the tactile firmitus. And now I'm going to percuss the lung fields. And so I'm just going to be trying to hear the tympanic sound. I'm avoiding the rib cage because that will just give me a dullness. Alright, and also I'm back here, I'm going to go ahead and demonstrate bronchotomy. So every time I move my stethoscope, if you'll just say 99, and I'm going to be listening for the muffled sound. 99, 99, 99, 99, 99, 99, 99, 99, 99. Okay. And I heard it to be very muffled. Okay, now I'm going to move to your front, inspecting the thoracic cage, looking for symmetric expansion and use of not a lot of accessory muscles. Then I'm going to assess for the tactile firmitus. So just say 99 every time I move it. 99, 99, 99, 99, 99, 99. 99. Perfect. Okay, and now I'm going to palpate for the lung field. What does that do? It's to show that your lungs aren't like full of fluid, because when you hit something that's full of something, like if I would have hit the bone, it would have been a very dull sound, but since your lungs are hollow, it's a tympanic sound, and so it's just to Show that there's no flare. I'm going to auscultate the one sets. Lots of deep breaths. All right, and now I'm going to move on to the heart. I'm just going to listen to you with the bell and the diaphragm of my stethoscope. Okay. And then when I get to your mitral valve, which is down here, I'm going to count for 60 seconds your apical pulse. Okay. So this is the aortic valve.
Do I need to take a deep breath?
No, you don't have to. No. You can still breathe. This is the pulmonic. Tricuspid. And then here's the mitral, and this is where I'm going to count for 60 seconds. Alright, and so she had regular rhythm, and the apical heart rate was 67 beats per minute. Next, I'm going to move to your upper extremity. I'm going to palpate your brachial pulse. I'm going to check it on this side also. Just make sure it's equal. Okay. And now I'm going to check your radial pulse on both sides. And then you're equal bilaterally. Next, I'm going to have you do a couple of range of motion exercises for your arms. So we're going to do pronation, supination, flexion, extension. For your shoulder, we can do circumduction for both shoulders. Very good. And then we can do abduction and adduction. And then for your hands, do flexion, extension, and hyperextension. This also is good for your wrists too. And then I'm going to check your strength in your hands. So if you'll just squeeze my hands. Very good. And now pull up. Push down. Awesome. Very good strength. Alright, and now I'm going to go ahead and have you lay down on the bed, and I'm going to inspect your abdomen. Okay. So first I'm inspecting for the contour and symmetric of her abdomen. She has a flat stomach, and it looks very symmetrical. I'll be looking for any pulsations so I can kind of like feel it. Any movements. She is rather thin, so you can kind of see the aortic pulsations. Her umbilicus is midline and right there, and symmetrically located. And okay, so now, so since there isn't any overt masses that we can see, our inspection is symmetrical and doesn't look like there's any lesions or anything. Now I'm going to auscultate all 4 quadrants. Okay, and I'm also going to do the scratch test for the liver borders. Well, it's a little ticklish. My patient's a little ticklish.
She is.
Okay. Okay, and I'm also going to check for the vascular sounds and any bruits. So I'm going to check her aorta and then go. And then the branches off the aorta. And I really don't hear any bruits or any vascular sounds. First, I'm going to do some light palpation. If you feel any tenderness or anything like that, just let me know. So I'm just going to go down like a couple centimeters, like 1. Just palpating. Alright, so no tenderness or anything. Okay, now I'm going to do some deep palpations just to test to see if there's any masses or anything like that. Okay, and I don't feel anything in the deep palpations. And then I can I'm going to stick my hands up under your ribcage and I'm just going to feel for your liver, okay? Okay. So just relax. Give my patient just a minute because this can be a rather ticklish part of the exam. Okay, I'm just going to have you take 1 deep breath. Okay, I could kind of feel like a little lobe of the liver. Over here, I might be able to feel the spleen. So I actually don't feel the spleen, which is good because that means that the spleen is not enlarged. Next, I'm going to check your lower extremities. First, looking at her legs for symmetry. Her legs look to be the same length. I'm going to just pull up your pant leg just a little bit to check your skin. So a pale, warm, but very, like, it's the same, consistent throughout the entire body. I also haven't noticed any like areas of redness that would indicate any ulcerations throughout the entire exam. First, we're going to do some range of motion exercises. If you will lift up your leg, straight, that's flexion, and then go back down. Lift the other leg, good deal. If you can bend your knees, perfect. And then do the same with the other leg, perfect. Now I'm going to do some with your feet. So I'm going to do some dorsiflexion, which is you pull up on my hands, good. So that's checking range of motion and strength in her feet. I'm going to check her pulse down here, the dorsal pulse.
Do you want me to take my sock off?
No, I can feel it. Or I might just take off this one.
Go.
Okay, and now I'm going to check for her popliteal pulse. That is just the pulse under here. And I probably won't hear it through the genes, and if it was in a clinical setting, I would pull up the genes and make sure I could feel it adequately. Also, I would be able to see if she had any varicose veins. So next, I'm also going to have you do a couple more range of motion exercises with your feet. If you can have them like turn into each other, turn out, and that's abduction, adduction. And then we are the dorsiflexion and hyperflexion. Okay, since I already have it laid down, I'm going to do your Babinski reflex, which is just, I'm going to stroke the bottom of your foot. Okay, and since her feet didn't curl out, that means that she was negative, and so that is very good. Next, I'm going to check your brachioradialis pulse, or reflex, and I'm just going to hold your hand here, just kind of test it. Yeah, that's good. And then I'm going to have you pull your foot right here, and I'm going to check your Achilles reflex. Let's see. I have the otoscope. I can use the finger of that. But I seem to have lost it. Okay. And so that is where I would check the reflex. And then I can also check her patellar reflex in this sense as well. I'll put my arm up here and then right here and like test for the reflex. I would also have like a reflex hammer, which would elicit a much better response. Okay, if you want to go ahead and sit back up. I can see like through all this that her joints are fluid. I've seen her move. I saw her walk in to the clinic and assess her gait that way, but all of her joints have been working. I haven't heard any creaking or anything like that. Do you have any pain in your joints really? Okay. So next, if you could just bend your knees, make sure your knees bend really well. Check with your other knee. Very good. Now if I could have you stand and face this way, face the wall, and just kind of bend, and I'm going to check for scoliosis of the spine, so just bend forward. And that was straight, and so that would be a negative sign for scoliosis. Now if you want to just kind of bend this way, do a little turn, and that's checking the range of motion of the spine, and so that is really good. You can go ahead and take a seat. Next I'm going to try doing the rapid alternating movements. So if you will just do this on your knees, just to make sure that is good. Very good. Now I'm going to have you do a finger to your nose test, so just with both hands, just that. Okay, and now if you'll do, put your ankle down your shin, like that. This is checking neurological responses. Very good. If you wouldn't mind to stand up one more time, I'm going to do the wrong bird test. And if you'll just close your eyes, and I'm going to see if you do a lot of like swaying. So just close your eyes and I'll just observe you for a second. And she stays pretty stable and doesn't sway or move a lot. Alright, go ahead and take a seat again. So I'm going to have you close your eyes, and I'm going to touch a finger, and you'll just tell me which finger I am touching, okay? A ring finger. Pinky? On which hand?
The left one.
Okay.
Thumb on the right hand.
Okay, very good. Okay, and now I'm just going to check for sensation. I'm going to use a pencil. The eraser part will be the soft end, and the lead isn't out, but this end will be the sharp. Okay, so if you'll just close your eyes and just tell me which end I'm touching you with. Dull. Dull. Sharp. It's okay.
They both felt the same.
Okay, so I'll try it again. Dull. Sharp. Sharp. Okay, I'm going to do it on your hands now. Dull. Sharp. Very good. Gonna do it on your legs. Dull. Sharp. Dull. Sharp. Okay, and do you have equal sensations in all of your extremities and everything? No numbness or tingling? Very good. Okay, and then we did the reflexes. Alright. So I think that will conclude the assessment. Do you have any questions for me today? No. Well, I really appreciate your time, and yeah, that concludes the video. Thank you.